So let me give you an example of this problem that we were trying to solve.
Thanks,
right?
Vicki.
So you see that...
taking care of that...
whoops, someone is...
FSBPT stuff.
Someone is, sorry, not muted. Okay, I'm going to keep going here. So, is digital media the best solution? So you see that, you know what, if you're going to build something that the world can use, the web and the apps are definitely the way to go. You have to begin somewhere. And we have always started in iOS because the iOS experience is the most polished. Now, the flip side to that is the bulk of the world is on Android. So when we built our first set of apps on iOS, the Android world came knocking on our door saying, hey, what about the other 80% of us? So again, you are not going to be able to avoid building for the different platforms. So briefly, let me give you a glimpse of the problem, right? A case study about movement. We thought that, man, every program teaches gait, but it's really hard to stare at these graphs and these pictures. So, are digital apps the proper medium? Why, of course, we're talking about movement. Why wouldn't we use videos and interactive tools to talk about movement, right? So, in general, what I've stated here is we've had our students trying to learn about movement by studying from static books, chapter by chapter. So maybe we could build an app, right, that would help clinicians learn about movements better. And so right now, we are in process of working on a functional movement app that is based on the premise of the GATE app. And I'll give you a glimpse of this in a second. Here's your traditional learning method. Here's our traditional textbooks. And this is not to take away from all the amazing work that the leaders of this have done. This is to build upon their work, right? To be able to change the way students can access this information and to learn deeply and integrate this into clinical practice. So you guys remember these graphs, these pictures, and you know that the students now live in this digital environment. Why shouldn't we leverage an app that could now put into motion human movement so that students can learn and stop the video at any point and learn about muscle activity? So when we talked about thinking, how are we going to build this app, we decided it would be very important. Right now I'm talking about the functional movement app, even though we use the GATE app as a test platform. So we want to be able to show normal movement, abnormal movements, be able to have a conversation about how abnormal movements can stress tissues and how impairments can relate to these abnormal movements, right? This is our objective exam. This is our impairment exam that our clinicians are supposed to learn to do. So in the app, we built the first parts of the app are all static pictures with a human, right? Here are the different phases. Here are the critical events, because when you're learning about movement, it has to be static. There's too much information when you look at videos right away. This is what the functional movement app is going to look like. So we are looking at common functional movements. This is forward bend and return from bend. And we have done EMG on paraspinals, on glute max, on key select muscles that we think tell an important story about why patients might have repetitive back sprains or muscle strains. So if you take a look, we are using the terminology of movement, initiation. This is this phase here. The body is just tipping past its center of mass. Here is execution. You can see that the erector spinae and the glute max are firing a lot because they need to stabilize the spine and hold it up against gravity. And then when you hit the termination phase, you can see that all the muscles begin to shut off. This is actually a critical moment of risk for patients about to get injured, because this means that your dynamic structures are no longer supporting your static structures. The load is being transferred to your static structures. Now, if you look at return from bend, here's initiation. Okay, initiation means that, wow, cool, glute max is kicking off the return from bend. I love it. Imagine if we could teach movement like this. That's why we cue the glute max to fire in the return from bend, because it kickstarts the movement. And eventually, of course, when the lever arm is long, you've got high levels of activity of the extensors on both paraspinals and glute max. This is how we imagine teaching movement. This is the app that will be coming out probably in about a year. We're doing a lot of data collection and data analysis. And then here's termination. Everything quiets down again. Imagine if that's how, in your kines class, you talked about here's lumbar, here is how we measure range of motion. And by the way, let's look at a few movements. Sit to stand, forward bend, return from bend, and look at how these different things happen and what would be the risk if someone, so this will be in the app, you can see initiation, the body's tipping forward. Now we're into execution. The glutes and the erector spinae are firing heavily. And boom, it shuts off. Now my local passive structures are loaded. They're at risk. And here is glutes kicking off the return from bend motion. Now both are ramping up. I would much rather share the load, of course. And then as I return, my lever arm is becoming shorter and shorter. My muscles can turn off. I mean, that's the story of movement. Could you imagine, Tony? Like the future of talking about movement will be changed forever. So, of course, we're doing the literature review. We're talking about critical events. When you look at someone who initiates with the hip versus initiates with their head, right, lifting from their head. And we're tying these movements to impairments that students would learn to examine in their classes, right? So we're building a bridge to stuff that they might already know. They know how to assess glute max weakness by the time they get to this course. So you can imagine the future app will look like this. It's no longer just about gait. It's about forward flexion, sit to stand, lunge, squat, step down, and here's the phases, right? There's going to be a learn, static pictures of the phases, the critical events, the range of motion requirements, the muscle requirements, and then analyze. Here we're going to watch videos of how these patients move. So you have... So we hope that this will be the future of talking about movement and helping students understand, clinicians and students understand why changing movement and facilitating optimal movements are so critical. I hope this excites. I hope this excites you guys. I can barely sleep because of these things that we're building. And you can see that we can basically show graphs and begin to help people understand that, hey, normally we can help compare movements, right, and muscle activity during different movements. So one of the things I always tell people when building apps is you always begin with the end in mind. You always think about what is the problem I'm trying to solve, and now I need to, I wireframe out how this app probably is going to look, how we should build it, what kind of content I need to build, and do I have the resources or ability to do that? Otherwise, you're dead in the water. There are many stages of building apps where you could find yourself dead in the water.